Okay, here we go. I think most of you will probably already know me. I will just introduce myself quickly. My name is Mariana. I am the CEO and co-founder of the Africancer. And I can see that Marie is here representing the Africancer team. She's one of our Qigong and Tai Chi practitioners. The session today is about providing virtual support to GYN cancer survivors. And so I invited two of our partners, Jill from Sherry Strong Foundation and then Shannon from Teal Diva, to come here and share our experience together of building this virtual support program for GYN patients. We're going to share some results about some patient outcome studies that we did. But before we get started, I just wanted to ask you to introduce yourselves. So, Jill, do you want to get started? Just introduce yourself and tell us a little bit more about Sherry Strong.
Sure. My name is Jill Burgdoff. I am the president of the Sherry Strong Foundation. Sherry Strong is named after my younger sister, Sherry, was diagnosed with stage 3C ovarian cancer in 2014. It was a long journey. It was a 9-year battle. And we were already doing some philanthropy work with pediatric oncology. But in our own personal journey, we learned a lot about the holistic medicine, the holistic therapy side of oncology. We're very intrigued, very interested, and just we're diving in, looking for ways to support Sherry throughout her treatments, surgeries, chemotherapy, and really got a sense of what was out there and what the options were, what we weren't hearing from our conventional oncologists. So we really dug in and really got a sense of how we could improve quality of life through treatment. And that grew into a website, sherrystrong.org. And then Sherry passed away in September of 2023. So then the actual nonprofit came to life um, post her death. And prior to that, we had set up funds at area hospitals to cover the financial costs of holistic therapies. Of course, after learning on our own journey that, these aren't covered by insurance, and just another financial burden, expense, I guess. So we set up some funds. We opened a couple clinics. We had found some needs along the way, in our own community, as well as another community in Florida. And so we had the brick and mortar piece, and when we came upon the after cancer, we were looking for a virtual component. So this was a perfect fit for us. And our mission is about accessibility, financial aid. We always want to have funding for patients who otherwise wouldn't be able to access the care. And just about support and education. Originally ovarian cancer, but holistic therapies bring you into all kinds of cancers. So
Yeah.
so education is huge for us as well.
Thanks, Jill. And just to drop a few names, so Sherry Strong actually opened an integrative oncology clinic within an event in Charlotte, just to give you an example of the work that Sherry Strong Foundation is doing. Really focus on integrative oncology. Shannon from Teal Diva, over to you. Tell us about yourself and your organization.
Thank you. So my name is Shannon Routh, and I am a 16-year, almost 17 ovarian cancer, clear cell ovarian cancer survivor. I started Teal Diva on my third chemotherapy. I did it because I was missing hope. I was 32 when I was diagnosed and felt like I knew one other person. She was 95, and I'd been involved in several other different nonprofits that Komen, Autism Speaks, and had been at their walks and the things that they did in the community. And when I was diagnosed, I was like, where's my stuff? Where's my opportunity to wear a tutu and boa and have my friends and family come out in support of me? What's my color? Where are all my things? And the more I looked, at the time, I didn't find anything really that was close to where we lived. And so I just felt like the Lord laid it on my heart. Maybe I couldn't find what I was looking for because I was meant to create it. And so I just wrote down every single thing that I felt like I was missing. And it started pretty much with a Facebook group of just trying to encourage other people. And one of my initial goals was to meet one other young person that was diagnosed. And it took me about a year before I was connected. And she too was 6 months into her marriage, no kids, and just thrust into this ovarian cancer diagnosis, and then all the things that go along with it that nobody talks about, the early onset menopause, like all of it, and the things that you're now a young person facing. You're at the beginning of a marriage, you don't have kids, you don't have grandkids, you're early in your marriage, and now you're facing things that someone that's 55, 60 and older are going through. And so just all of the things. So I just kind of felt like what was missing for me was hope, and to be able to sit in front of someone that looked like me and to see that they were doing well would have meant the world to me. And so we try to do that for others. We are a support group, but I don't love the clinical thought with a support group. We are a support group outside the clinic. We are going kayaking this Saturday, where we do things that are non-clinical, that with GYN patients, lunches, dinners, kayaking, crafts, whatever, just to get you outside of the clinic, to remind you that you had a life before cancer and you have a life after cancer. And you got to find the balance between who you were then and who you are now. And oftentimes it's relating to someone else who's walked that battle or walked the road that's similar to yours, to be able to say, I get it. And to validate a lot of what you're going through. That helps create or curate kind of a balance for you, or for the patient, to walk forward. And that's where we lean heavily in our mission, is that it goes beyond the clinic. I was just talking to someone today who just said, I was thrust into it. And I told her, I was like, you were in a tornado. And she said, and I didn't start feeling the feelings until I go to my last day of chemo. I'm supposed to ring the bell and be done, but I was terrified. And that's when she started feeling all the feelings that she had been holding for 6 rounds of chemotherapy. And that's really where Teal Diva wants to step in and work with someone. And what we didn't have, what we were feeling very overwhelmed by, was providing counseling services, providing the assistance, we don't have a degree. Our degree is in our own story, right? We don't have those PhDs in mental health. And what was great when the After Cancer came to us was that they met a need we were searching desperately for, which was that counseling service and that mental health piece with certified those who are certified in that field. And so that was what was very appealing to us. And to be able to reach more virtually, we are in a tight-knit community as far as our face-to-face goes. And to be able to provide these services that they provide on a more national scale was what was inviting to us. So yeah, we thank you all for coming today.
Thank you, Shannon, for sharing more information about Teal Diva. I actually added both of your links, Teal Diva and Cherry Strong, to the chat. For those who didn't know you before, they can go visit your websites. So, just to get started, I just wanted to share a very high level introduction to the after cancer, and then we're going to go deep into the results of this pilot. So, to give everyone some context, when Shannon, Jill, and I started working together, we put together a pilot program for 6 months where we would be recruiting GYN patients and supporting them via the after cancer. And during that pilot, we did measure patient outcomes. And so we're going to present you the results that were unbelievable in a few slides. So just so that you understand what the patients had access to within the After Cancer platform. So we are a virtual survivorship platform, and we provide evidence-based support to patients' day-to-day survivorship needs. And we do them in mainly 4 different things. So we have an educational library with a lot of content that patients can follow at their own pace. There were specific GYN information there. We created this Healing After GYN Cancer gallery of videos that talked about sexual health and menopause and other very specific GYN symptoms. Then we have group sessions. So it's a calendar of group sessions. There's something happening every day. And it ranges from yoga, mindfulness, Qigong here with Marie, presentations by Dr. Chase Billy Dordan, who's one of my co-founders, who's also here in the call, Q&A with doctors. We brought in experts in menopause and sexual health to talk about it and answer the patient's questions. And then we have specific group chats and communities. We call them circles. And so we created a specific GYN community here that was moderated by a peer, so cancer survivor. And we saw beautiful conversations in between the different users. This community also met on a support group. We also don't like the name support group, Shannon, so we're with you. So that's why we're calling them circles. And then these patients also had access to asynchronous support. So whenever they had a question, we always told them, come to us, write us on the chat. We'll find the best answer. Between our care team and the resources that we know, we'll find you an answer that is evidence-based. So make sure that you're not going on Google or Dr. Google for medical advice or anything like that. So this is what the patients had access to for 6 months. Let me walk you through how the study was put together. So we capture real-world evidence of these patients. The patients were recruited in collaboration with Teal Diva and the Sherry Strong Foundation, and we had a total of 67 patients who were enrolled on the program. And then the outcomes that we measured over time during those 6 months, we used 3 different instruments to measure those outcomes. So FACT-G for quality of life, FCRI for the fear of recurrence, and then WPAI for work productivity and impairment assessment. So we actually ended up having almost 50% of patients who completed the pre and post intervention assessments, which was a really good rate considering this was not mandatory. It was really up for the patients if they wanted to share their outcomes and results with us. So let's go into the results, which is the best part. So within this period, we saw a 21.6% improvement in overall quality of life. So this was the result of the FACT-G. And then there were 2 specific measurements within the FACT-G that we wanted to point out. So we saw 28.2% improvement in emotional well-being. A lot of our content is in emotional well-being, and I think a lot of the benefits that we share with patients in terms of the communities and the support is in emotional well-being. So it was wonderful to see this result. And then we saw the symmetric 28.2% improvement in functional well-being. So really great results. We then, moving into fear of recurrence, so we only ended up measuring those for participants who have a high baseline fear of recurrence at the beginning, and we saw that it decreased by 22.5%. And then last but not least, in terms of work productivity, this was an assumption that we had. If we're not feeling well, we're not feeling as productive as we could. And so we did see a reduction on that perceived impact of health problems while working and while being productive of 20%. So these were the results of the pilot that we created. And I would love To first maybe touch on what is, in your view, the main challenges that GYN cancer survivors have in finding resources and support in survivorship. Shannon, I see you're already on mute, so do you want to share your view?
I'm so sorry. Ask the question again. I'm so
No
sorry.
worries. What are the main challenges that these GYN survivors have in finding the right resources and support? I think you shared it a bit from your own experience, but now as you're managing your own nonprofit, what are you seeing?
I think it's just finding hope and having access to other people and being able to be in those. I'll just say from personal experience, 2 weeks ago, we made a phone call to vet someone that had applied for one of our services. And when she picked the phone up, we were just like, so we saw that you needed some lawn mowing. And she just broke down in tears. And we're like, okay. And the more that we talked to her, we're like, tell us a little bit about yourself. And she, again, in tears. And so we were chatting, and she just had no one. She lives in the middle of nowhere, and she was embarrassed to tell the hospital staff, her doctor, her nurses, her care team, that she was so depressed, she was contemplating suicide. And the moment that we called, she said, "You don't know, you were an answer to prayer at this very moment." And what she was facing is her husband's had Parkinson's, was in the middle of a hospice. He's going through hospice, and she has another person that she's caring for out of her home, and no one was there to care for her in that moment. She had tried to reach out to other support groups. Again, she lives in the middle of nowhere. It is not an active community like a city, like you might find in a metropolis. And what she was being told when she was calling these support groups is she didn't have the right kind of cancer, and which is wild. To me, that is wild. And so immediately we got her involved with our network, and trying to get her plugged in. And we can't take away all the symptoms that she's feeling and all the things that she's going through. But when I did contact her social worker, and her social worker contacted her doctor, the patient came back to me and told me that the doctor shamed her for not reaching out about having had those thoughts.
Yeah.
And when it was all confidential. I reached out to the social worker, and I just said, we're not equipped to do with it. I want to make sure that those who are know about this. And the social worker just it was all documented in her file. It had nothing to do with us saying anything, but they didn't catch it. And
Yeah.
so for her specifically, and just even the woman I spoke to today, I mean, there's missing the mark in that community, and
Yeah.
I not even just the community in general of gynecologic cancer support. And it doesn't have to be a clinical support system, just a mentorship or something. There needs to be, that you need to feel normal in the space that you're in.
Yeah, I hear you, Shannon. And I think you mentioned something really interesting, that idea of having the wrong cancer. I think within women cancer, we see so much things happening within breast cancer that I've heard some of our GYN patients saying like they get triggered in October because everything is pink, but there's not a teal month, right? And there's so many more resources for breast than for GYN. I really think that patients feel an impact, or that they had the wrong cancer, but there's no good or bad cancer to have, right? I don't know if you've
I
had.
will say, when you're diagnosed, I'm going to say this coming from a survivor here.
Yeah.
Breast cancer is celebrated in a way. It doesn't make it that it's an easier cancer to go through. It's still hard, it still sucks, it's still awful, but it's celebrate. You're save the tatas, you're wearing them there. All of this like fun marketing that coincides with breast cancer. And when you're diagnosed with a gynecologic cancer, you feel dirty because you've got this below the belt cancer that no one really talks about, because we don't say those words in public. I was doing a public talk one time, and I got ridiculed for saying the word vagina. I mean, that's, so I just feel like we as a society don't allow I guess there's just an uncomfortable stigma around a gynecologic cancer, and the freedom of talking about what we're going through as women. We feel dirty and we feel shameful, and we don't feel like we can, ovaries aren't necessarily a party topic. The only time you talk about your ovaries is when you need them to procreate or when something's going on. And so for me personally, that is coming from a survivorship and dealing with a lot of women. I think it's amazing the work that breast cancer has done with their marketing and making people feel whole and wonderful and amazing. We're just trying to do it in our own space. And we do have a month, but it's just people don't know about it. We try, but I agree. It's just not, it's talked about.
Yeah. Thanks for sharing your personal experience doing this. Jill, a question for you. So you've had this brick and mortar experience where you are helping set up integrative oncology clinics. You saw the After Cancer as a platform to help you do that virtually. Within the After Cancer, we have a lot of different modalities within integrative oncology. So there is nutrition, there is stress management and mindfulness, physical activity. We talk about complementary therapies too. I would love to hear your experience maybe with Sherry and how seeing her navigate all of these different integrative oncology modalities.
Yeah, I think for us, it started with um the yoga, the right, and each patient's different in that, okay, where are they at in their journey? For us, after surgeries and chemotherapy weeks, we'd kind of have a schedule. And yeah, we started with, the mindful meditation and the yoga. We dug deep into diet, and just learning about what food could do to support her body through treatment. But I think, just seeing what kind of she gravitated for, like once we learned, okay, there's options, right? And we learned a lot through working with the hospitals and the art therapy, the music therapy, the journaling. She was very big into journaling and writing down her thoughts and her fears and her good days and bad days and just all the things. And just, I'd see her gravitate toward, we thought, gosh, we hit the jackpot. Like there's so many things that we could do and that we could do at home, and that she was doing to make a difference in her quality of life, right? And she had control of it, and she was on her timeline, and when she needed it or didn't need it, and that would change, right? So I think, both virtually and at the wellness centers, I think that just comes down to, like Shannon touched on a little bit, just access to the care, right? If you aren't if patients aren't in a position to, I don't want another appointment, I don't want to find transportation again, wherever, like I said, wherever they're at, I mean, that's just the beauty of the virtual component of it. So I think, right, the modalities are all so similar. Other than when we had previously talked about, acupuncture, and we don't want anybody using any needles at home. But everything else, it can be done. And I wanted to share because throughout the week I was thinking about Dr. Bailey Dorton, and we had known
who's in the
her.
house. She's here.
Yeah, hello. Well, we had the pleasure of meeting Dr. Bailey Dorton throughout our journey. And I remember her saying, and not verbatim, but if something to the fact, during COVID, when patient contact was limited, you weren't adhering to your normal schedule. She said, had you told me, anytime before COVID that I would see patients virtually, like I'd have told you were crazy. So I think COVID, right, really opened up, and we were having the same experience even on the clinical side. I mean, we started seeing doctors like and we had doctors across the country. So we were able to see doctors virtually. And I think that's the same sense here of we can do so much and the patient doesn't have to leave home. And and the platform is a great example of, whatever modalities touch them or whatever they're drawn to or whatever they're finding helps them, right? They can access those parts and see the change and see the difference. And of course, like Shannon spoke of the community of it all, right? We're not getting community in our house, but we can certainly, and you mentioned it, we saw amazing connections in the circles. And I think those are connections that are going to live on, right?
Yeah, and
For
they're
a lot of
living
them,
on.
yeah, a
If I can
lot of them,
share it.
this is a long journey. So, texting or FaceTiming or whatever, sharing, experiences weekly or whatnot, I think is just invaluable.
Yeah, we're actually one of the patients were part of this pilot. She's having a recurrence at the moment, and she's a young adult. She was always very active. And so she shared that the other day on the group chat, asking for support. Like, I'm doing this cocktail. Have any of you done it? What worked, what didn't work in terms of managing side effects? And it's been unbelievable to see like everyone stepping in and sharing their experience. And I've done that. Ask your doctor this worked, this didn't work. And it's really, really powerful. And I'll be honest, I was worried because I know when you hear about a recurrence, it always triggers that fear of recurrence that you might have as a survivor. And so how do we manage that in a group? And I think we saw the result and everyone is helping each other. I think even Lauren, by sharing her own experience, she's helping the other participants who live with that fear of recurrence because she's saying, I can do it and I have the resources and the tools in the community that will help me go through this recurrence. Chase, I saw you're here on the call, so I would love to get also your view. You've met a lot of these women who went through the pilot. Some of them had a consultation with you, others you met them on group sessions. Like, what was your take on this GYN pilot?
I think one of the key things is by doing it virtually, you're giving them a safe place to express what they're going through. And some people feel like, my family's already been through so much. Can I really be open with them and share my fears and what I'm going through? And this gave them a safe place to do it with other people who've been through it, because nobody else knows what it's like unless they've been through it. And I think giving them the safe place to open up all these fears in the comfort of their own home, like Jill said, you don't want to have to go in again to the facility that maybe triggers your fear, or they're not addressing these issues when you go in. And so I think really that safe place is really important.